Hi, in this video we'd like to discuss our HCG desensitizer for hyperemesis gravidarum. A lot of our patients are actually inquiring about this treatment, and today we'd like to explain to you how it exactly works and helps you recover from your hyperemesis. So, as we've discussed in our previous videos, we know that hyperemesis is caused by your own hormones during pregnancy. It's not of any external cause. And this hormone is a very specific pregnancy hormone known as HCG. That is why you only develop this during pregnancy. And once pregnancy ends, your hyperemesis ends as well, because it's tied closely with your HCG levels. So HCG has very important functions in the body. First of all, it promotes the development of the embryo into the fetus. It also promotes increased maternal blood supply to the pregnancy, and also it helps prepare the uterus, vascularization for the implantation, and also the pregnancy development. And it has several other functions as well. It's a very important hormone. And how it actually has this interaction is that these locations within the uterus, they carry specific receptors that will bind with the HCG molecule, and then it will trigger this reaction of the functions that are associated with HCG. Without these receptors, there will be no function that we will observe. That's why HCG will bind with this receptor, then only we will see an outcome. So the same thing can be said for your hyperemesis. Exactly how it promotes embryo pregnancy development, it actually causes and affects severity of hyperemesis within you in the same mechanism. Within your body exists these abnormal receptors that normal pregnancy women do not have. However, you will have these receptors, and for reasons that we are not too sure as well, but we believe that there is a genetic link behind this. That's why only very few people have this these receptors, and usually people who have these receptors, who develop hyperemesis, they have a family history as well. But there's still more research to be done to determine this. So because you have these receptors, the same way how it binds with receptors in the uterus to promote uterine development for pregnancy and embryo development, it will bind in the same way whenever these abnormal receptors are found, wherever they are found. And usually they are found within effector glands and several organs of the body. So we can say they exist systemically. So when they bind with these receptors, these HCG bind with these abnormal receptors, which can happen during pregnancy, they will cause a hypersensitization reaction, also known as a central sensitization. This will cause the receptors to fire non-stop, causing a reaction to happen, to trigger the reaction, which is these glands secreting non-stop, these organs contracting non-stop, will lead to all these symptoms that we observe of hyperemesis. It will cause you to be extremely sensitive to your environment because of this reaction. So symptoms that we know of, the few prominent ones are the insomnia, because you are especially sensitive to light and sound, making you unable to sleep, excessive salivation, because the salivary glands carry these abnormal receptors binded with HCG, causing it to secrete non-stop, and you have the excessive vomiting, nausea. All of these can be linked back to the same mechanism. So our treatment here, especially when done before pregnancy, is that we block these receptors that are found within systemically, and it won't affect the development of your pregnancy, and it won't pass through the placenta. It is not tetragenic, won't cause any harmful side effects. Its only function is that it will bind these abnormal receptors, blocking them. So when the real HCG starts showing up in your bloodstream during pregnancy, there will be no binding reaction because it's already taken up. So you won't develop hyperemesis, and that's how we can ensure that you will have a full recovery with no complications, full-term smooth pregnancy. That's why we always advise our patients to receive this medication, receive this treatment during your early weeks of pregnancy, or even better, before pregnancy, and then you can conceive within the next few months. So our treatment is also very easily administered via injections, and only within 3 to 4 doses, and you can go on to have a successful full-term pregnancy. If done during the midst of pregnancy, especially when hyperemesis has already developed, then we might need to have further managements, because at this time we cannot suppress significantly the symptoms, because many of them have already binded with the receptors. So we can only guarantee a full recovery if you receive treatment before and early weeks of pregnancy. However, you can still see an improved condition if you come during the midst of hyperemesis. We just need some additional managements with oral medications to help with your complications and your pre-existing disorders, and this can vary from individual to individual. So we hope that this video answers that question, and if you'd like to receive this treatment or find out more questions about our HCG desensitizer, please visit the website, read our articles, and also arrange a consultation with us today to find out more.